All right, welcome to week 8. We are in the last week of the semester. We have a lot of ground to cover, so don't give up, don't get complacent. Our subject for this module is domestic policy, which refers to the government's uh, policies that apply directly to citizens' behaviors and governance within U.S. borders. This is a longer assigned reading because, of course, domestic policy is truly a sprawling array of laws, policy, and programs that seek to promote the general welfare as supported by the preamble of the Constitution. Um, as we've learned over the course of the semester, the agencies of the executive branch are responsible for implementing the laws passed by Congress, and the president is responsible for ensuring that the laws are faithfully executed. Domestic policies exert a subtle but certain significant influence on Americans' day-to-day lives. The food we eat, for example, goes through an inspection process to ensure that, for example, meat is not tainted. As taxpayers, most Americans' employers are legally required to withhold a percentage of their income. Likewise, most Americans work in a place of business where safety is protected by federal law, where your work conditions are basically subject to regulation. So, what are the roots of domestic policy? Domestic policy has three kind of main well springs. The Constitution is one, congressional statutes are two, and the bureaucratic agencies of the executive branch also do something that's known as rulemaking. They also engage in adjudication, which have again domestic policy implications. So first, the Constitution provides the broad outlines of the federal government's role in domestic policy. When the government is functioning smoothly, federal, state, and local officials and governmental agencies act collaboratively and cooperatively. Second, Congress plays an important role in shaping domestic policy by creating, funding, and providing oversight over specific programs. Third, the president is responsible for enforcing and implementing congressional legislation, as I noted a little while ago. Presidents have extensive authority over the actions of executive branch agencies, but civil servants oftentimes enjoy a degree of autonomy over their implementation strategies, which is something we recently discussed as administrative discretion in an earlier module. So how do Americans decide whether a need is sufficiently great as to require a federal program? A number of factors contribute to the creation of federal law. First, the mass media can't tell us what to think, but they can influence what we think about. And that framing and priming influence can raise the profile of an issue area that contributes to the perception that something needs to be done and that the federal government is the best way to do it. So to illustrate, the more intensively the media covers the more than 300 mass shootings that have occurred in 2022 has contributed significantly to the perceived need of both Republicans and Democrats that they need to be seen doing something to reduce the number of mass shootings. Now, of course, Republicans are far more supportive of sort of an unregulated Second Amendment environment where anyone can get access to a gun. But again, the challenge is in a midterm election year, they don't want that issue to still be on the board in November when people are casting votes. And so they wanted to do something largely symbolic, and Democrats were willing to let them do something, mostly symbolic, just to try and be seen again doing something. Interest groups can exert a real influence over whether or not government will respond to an issue. To illustrate at the state level, in the early 1980s, a woman named Candace Whitener lost her daughter to a drunk driver in a hit-and-run accident. As a result, she formed Mothers Against Drunk Drivers, MAD, and worked hard to raise the federal drinking age from 18 to 21. MAD has also been very effective at lobbying state governments to raise and increase the penalties for drunk driving. Conversely, part of the reason why federal gun laws have been unchanged for over 30 years until recently was the power and influence of the National Rifle Association, the NRA, which used its enormous fundraising and lobbying power to threaten any member of Congress who expressed a willingness in any way to restrict access to guns or to regulate the use of guns. How has domestic policy evolved in the United States? Prior to the 1930s, most domestic policy was undertaken by state and local governments. And in fact, local governments were responsible for creating and implementing most domestic policy. However, over the course of the 19th century and into the 20th century, the country began changing in fundamental ways that drew the federal government into the domestic policy business. There were two industrial revolutions that occurred, one right after the Civil War and one in the early 20th century, that transformed America demographically, leading to the movement of tens of millions of Americans out of rural areas and out of largely agricultural occupations and into more urban areas. Fewer and fewer Americans were working in the agricultural sector in this period. Overall, the population of the United States expanded significantly as a result both of natural birth rates and large influxes of immigrants from Southern Europe and Asia. Changes in immigration that produced a significant amount of backlash from Americans fearful that non-white and or non-Christian Americans were going to change America for the worst. Does that sound familiar? Kind of like what we're dealing with today. The Progressive Era was the first period where the federal government began regulating large industries. The Interstate Commerce Commission is an example of a regulatory agency, again, that was designed initially to oversee the railroad industry, which at that time had established an effective monopoly on the movement of bulk goods and could charge whatever freight rates they wanted, which, for American farmers, that really infuriated them and kind of led to calls for reforms. The assigned reading discusses the role of journalism in many Progressive Era reforms. For example, in 1906, the muckraking journalist Upton Sinclair published The Jungle, which documented the unsanitary and unsafe practices in Chicago's meatpacking industry, leading the Republican administration of Theodore Roosevelt to encourage Congress to pass the Meat Inspection Act later that year, which prohibited the sale of tainted meat, as if you need to tell someone, please, legally, don't sell, spoiled meat. It also mandated the inspection of livestock prior to slaughter and created sanitary standards for slaughterhouses and meat processing plants. As the scope of these responsibilities became clear, Congress passed a number of amendments to the Meat Inspection Act, empowering the Department of Agriculture to conduct research on food safety and creating the Food and Drug Administration, the FDA, to better manage the safety of the food supply chain more generally. So why is the federal government responsible for food safety? Think about the interstate dimension of the food you eat. With a few exceptions, nearly every food item you encounter in a supermarket came from another state or came from even indeed another country. State and local governments simply lack the resources to effectively oversee the safety of the food that comes into their states. The federal government, because again of the ratification of the 16th Amendment in 1913, which created the income tax, has the capacity to use its taxing and spending authority to do things like regulate to ensure that food is safe and nutritious. As we noted in our discussion of federalism, the economic calamities that culminated in the Great Depression fundamentally changed the nature of the federal government's relationship to the states, between the federal government and the states, and between the federal government and citizens. Franklin Delano Roosevelt's promise of a New Deal in 1932 led to crushing Democratic victories in Congress and the rapid passage of an enormous amount of legislation to combat the Great Depression and get people on their feet. And a lot of those things are still around today. Things like Social Security, these reflect sort of that period and the expectation that the federal government needed to do something to try and combat poverty. Political scientists like to describe the policymaking process as kind of a circular life cycle, right? So the initial phase is what we call agenda setting, and that typically begins with what is known as problem recognition, where collectively we begin to recognize that there's a serious social or political problem that may require a national response rather than expecting either a private resolution or for the lower levels of government to play around and experiment with responses. Think about the opioid crisis, immigration, mass shootings, things like that. The kind of policies that will emerge nationally will depend on the nature of the discourse surrounding those issues, particularly as it relates to electoral politics. The second step in the policy cycle is described as policy formulation. This is where, again, leaders of the political institutions seek a preferred option for dealing with a problem. For example, in 2016, Donald Trump campaigned as an anti-immigrant, or he would say anti-illegal immigrant president. He believed strongly that the solution to undocumented immigration was to build a wall. The challenge he confronted was that he couldn't even persuade his fellow Republicans in Congress to prioritize building the wall, and so he wasn't able to lead the remaining political institutions in his desired direction. The third step in the policy process, in the policy cycle, is policy adoption. And that, got a misspelling in here, and that is where Congress gets to work and passes legislation on a given issue. The assigned reading discusses the last significant piece of domestic policy legislation, which was the Affordable Care Act, passed in 2010, which, again, what was the point behind it? There were too many people, too many Americans that lacked access to health insurance, which meant that they didn't have access to health care. And so, again, the main point behind the ACA was to reduce that number of people who lacked insurance. Okay. The fourth step is policy implementation, which involves federal agencies identifying strategies for converting legislative intent into actual practice. And again, very often Congress passes relatively vague legislation and says, you're empowered to do these things, just do it, make it so. The assigned reading notes that when the Affordable Care Act was implemented, it fell to key agencies within the Department of Health and Human Services, including the Food and Drug Administration, the National Institutes of Health, and the Centers for Medicare and Medicaid Services, to actually formulate rules governing how how the law was supposed to be enacted. The problem with the Affordable Care rollout was that a key element of the law required the creation of online healthcare exchanges, which the federal government lacked expertise and instruction to they made a hash out of it initially, and Obama ultimately was compelled to go to the tech industry to hire private contractors to get the systems up and running. The final phase in the policy cycle, and how the cycle it closes the loop, is this notion of evaluation. And that's important because public officials have to be good stewards of tax dollars. They have to be seen being careful managers of the public's money. Policy evaluation enables political actors to assess whether legislation is working as intended, whether there are correctable problems within a given program, or whether a program is so ineffective or inefficient as to require that the program be suspended or canceled. Program evaluation can often be contentious. Federal programs generally are viewed through the lens of partisanship, and in recent history, the general tendencies have been for Republicans to approach evaluation of federal programs from an adversarial perspective, and to advocate for cuts or even elimination of many programs. Those programs have defenders, though, who will lobby Congress to advocate for the continuation of even controversial programs. Democrats generally believe in and support many, if not most, federal programs because they're the ones that created them. The food fight that took place over many years following the passage of the Affordable Care Act illustrate this kind of partisan infighting. Republicans, when they took control of Congress in 2011, tried over 60 times to repeal the ACA. They were campaigning in midterms and presidential elections. We're going to get rid of the Affordable Care Act. Repeal and replace. Repeal and replace. And even when they got unified control of the federal government from 2017 to 2019, they were unable to repeal the Affordable Care Act because there were splits even within the Republican Party. And many Republicans were concerned that all they had in place was repeal. They weren't going to be able to put in place a healthcare infrastructure that would have avoided real problems going forward. I'm going to close this presentation in a minute, but I thought I would briefly go over some of the main categories of domestic policy. First, we have to make a distinction between contributory and non-contributory domestic programs. Contributory programs include, for example, Social Security, which is a social insurance program that withholds money from employee salaries that go into a trust fund in combination with employer matching contributions. Those funds are then distributed when Americans reach the age of eligibility. You have to actually apply for Social Security benefits, and then you get a monthly check from the government. And depending on how much you earned over the course of your working life, it could be $1,200 a month. It could be up to $3,500 a month. So in contrast, non-contributory programs are what we call means tested, which means you have to be able to demonstrate an economic need in order to be eligible for a program. And those include programs like Temporary Assistance for Needy Families, TANF, or the Supplemental Nutritional Assistance Program, or SNAP. The point of non-contributory programs is that they're designed to help people get through tough times and provide them assistance to extricate themselves from poverty. In terms of broad programs, both contributory and non-contributory programs fall under the category of social welfare. That is, they're intended to reduce the worst aspects of poverty in hopes that those programs will get people back on their feet. A great deal of domestic policy is dedicated to regulating economic activity. Now, here in Oklahoma, regulation is a bit of a dirty word, but it's important to recognize that most of the federal government's regulatory activity is aimed at protecting Americans either as consumers or as workers. Not all economic policy is regulatory in nature. Federal agencies provide a huge amount of data on economic performance, calculating the gross domestic product, for example, the GDP, monitoring economic activity for signs of inflation, of which there are plenty at the moment, unfortunately, and calculating the threshold for poverty. These are just examples of the kinds of statistics that are used to keep economic growth steady and to prevent recessions, which economists can tell you are periods when the economy is actually shrinking in size due to the lack of business activity. The main instrument for controlling and preventing recessions is called monetary policy, and that involves controlling the amount of money that is circulating through the economy. The main institution for managing monetary policy is the Federal Reserve Board, which is an independent regulatory agency that controls marginal interest rates, which are the interest rates that banks attach to other, when in terms of extending loans to other banks, right, to private banks. So when the Fed cuts marginal interest rates, they're basically encouraging more money to flow out into the system. When they raise interest rates, they're doing so because the economy is showing signs of inflation, which is, in simple terms, too many dollars chasing too few goods. Those are instances where, again, that can lead to rapidly rising prices, which creates inflationary pressures. So what are some factors that contribute to inflation and can lead a country into a recession? Right now, many of the trends have been caused by COVID-19, which precipitated government shutdowns and created supply chain bottlenecks and again, caused the government to push a lot of money out into the economy to try and support people who couldn't work. Events in the world have also contributed. Just before the coronavirus pandemic, Russia and Saudi Arabia engaged in an oil price war, dumping huge amounts of oil onto the international marketplace in hopes of expanding their market share. And a subsidiary hope was to drive some American companies engaged in fracking, which is hydraulic fracturing. They wanted to drive those folks out of business. Meanwhile, Russia's war on Ukraine has contributed a great deal to uncertainty surrounding oil supplies, but also the supplies of sunflowers and wheat and a lot of other, because Ukraine is a major agricultural producer. And again, so the fears that the war could spread and disrupt oil production has fueled concerns about access to oil and is contributing to rapidly rising prices at the pump. There is a partisan edge to discussions about what is currently driving inflation. Republicans want to blame Biden's policies for rising prices, while Biden is trying to shift the blame, characterizing the rising gas prices as the Putin price hike. A nonpartisan explanation for rapidly rising inflation is the Fed itself. The Federal Reserve has kept marginal tax rates abnormally low for over 20 years. And that has encouraged levels of risk taking that likely is going to be counterproductive. So I'm going to stop here. As always, if there is something in the assigned reading or in this presentation you don't understand, please consider asking a question in the weekly discussion. Let's have a great week.